My name is Dr. Ravi Patel. I'm a cornea and cataract specialist, and I'm in private practice in Long Branch, New Jersey, and on the cornea service at Wills Eye Hospital. So I kind of have a hybrid practice between academic and private practice. I think it's always important to be innovative, to find new things for your patients, to meet sort of unmet needs. And you want to make sure that what you're going to do for them isn't going to cause harm, and it's going to give them the quickest and the best chance of recovery from whatever disease they have. I've used both of the products, and while the dehydrated version of amniotic membrane, I haven't found that to be much more helpful than a traditional bandage contact lens. It often doesn't stay on the ocular surface where you place it, and it is harder to fixate where it needs to be. The other issues that I've had with it is that sometimes it gets incorporated into the epithelium, so the patients end up with this whitish haze that takes a long time to go away. The rapidity of the healing with the cryopreserved product is just far superior to that of the dehydrated product. So when we're doing a procedure that I want the patient to heal without scarring, I want that epithelium to be closed quickly. Whether it's polishing a Bowman's membrane for ABMD, or it's a superficial keratectomy for a Salzmann's nodule, I'd rather them not form that haze again. So the cryopreserved product, it just works quicker, and I find it to be that much better than a bandage contact lens. That wow moment for me came from amniograph, and it was a patient that now maybe about 6 years ago that was referred to see me, and I was probably the fourth person that this lady was seeing after cataract surgery. She had had terrible vision, and it wasn't that her acuity was poor, it was the quality of her vision. She kept complaining that her vision was filmy, her eyes were watery, and her vision just wouldn't get better. And it didn't have the traditional signs of dry eye disease that had that diurnal curve, where she'd be better in the morning and worse in the evening. She was bad at breakfast, bad at lunch, and bad at dinner. And everybody wrote her off with, they put punctal plugs in, put her on topical therapies, more drops, more lubrication, and nothing really worked. And when you examined her, she had a tremendous amount of conjunctival chalasis. And honestly, I didn't even know what that was at that time. But I'd heard a talk from Shepard saying about this disease entity. And I'm like, this could be the reason why this patient isn't doing very well. So I talked to her about it. I'm like, look, this is the first time that I'm doing this. You've tried everything else. Why don't we do this? It's a simple enough procedure in the operating room. It takes about 20 to 30 minutes to do. And your recovery, you should know within a few days if you're better. And I was setting her expectations to kind of say, let's see if you get a 50% improvement out of this. And the wow moment came on post-op day one, when she walked into the office with the biggest smile on her face, and her eye was white because we glued down the amniotic membrane. And she said, I'm cured. I don't have any filminess, and that was less than 24 hours after surgery. So what she had intended to get with cataract surgery, she actually ended up getting out of conjunctival chalasis repair. And that has then motivated me to look for the problem and then find other patients that we could benefit with that, because I truly think it's an underdiagnosed and undertreated disease.